Hello, my name is Brenda O'Brien. I'm a colorectal patient navigator with Northwest Community Healthcare. I'm glad that you're here and listening to this important message. Colorectal cancer is the third most common cancer in men and women. It is the second leading cause of cancer-related deaths in the United States. 1 out of 20 people will be diagnosed with colon cancer in their lifetime. And 1 in 3 adults, ages 50 to 70, are not up to date with their recommended colon cancer screening. These statistics are alarming, but I want you to know this. The majority of colorectal cancer cases can be prevented by having a regular colonoscopy screening. Colorectal cancer starts in the colon or the rectum. These cancers can also be called colon cancer or rectal cancer, depending on where they start. The cancer begins when cells in the body grow out of control. There is a risk that the cancer could spread to other areas of the body. Unfortunately, there are no signs or symptoms of early-stage colon cancer. That's why it's so important for you to be screened. As the cancer does become more advanced, symptoms could show. These symptoms include rectal bleeding, blood in the stool, any change in bowel habits or stool shape, decreased appetite, unintentional weight loss. Some people will say, I don't need a colonoscopy. I know that my rectal bleeding or blood in the stool is caused by my hemorrhoids. Well, that is not the right way to think. You need to rule out if it's hemorrhoids or if there's something else going on in there. So it is very important to be screened. Colorectal cancers usually begin as a polyp. We could remove polyps to prevent cancer. In fact, removal of polyps can prevent up to 90% of colorectal cancer. A colonoscopy is considered the gold standard because it allows us to see the entire colon and the rectum and remove polyps. This means that a colorectal cancer is highly preventable. So, should you be screened? Well, you and your doctor should discuss if you need colorectal cancer screening if you are at higher than average risk because you have a known family history of colorectal cancer, benign polyps, a hereditary syndrome such as Lynch syndrome, and FAP. If you have an irritable bowel disease like ulcerative colitis or Crohn's disease, pain, or a change in bowel habits or bleeding. To determine the appropriate screening plan for you, please talk to your primary care provider. There are other types of colorectal cancer screening tests available. However, it's important for you to know that depending on what they show, you may still require a colonoscopy. There is a FIT test, or a fecal immunochemical test. It detects hidden blood in the stool. It has to be ordered by your primary care provider every year. Please know it does not detect polyps, and if it does find that there is blood in your stool, you still need to have a colonoscopy. There is another test too, similar to FIT, called Cologuard, which can also detect hidden blood in the stool. This test could be ordered every 3 years. Depending on the results, you may also still need to have a colonoscopy. So one other test is a CT virtual colography, which is a CAT scan to look for cancers and large polyps in the colon. While you are not sedated for this type of test, it does require a bowel prep, and it typically needs to be done every 5 years. It could miss flat and small polyps. And if it detects any polyps and potential cancer, you will still need to have a colonoscopy. If you do choose this type of screening, please verify coverage first with your insurance provider. I want you to know that I worked in a GI center here at Northwest Community Healthcare for almost 20 years. I cannot emphasize enough how important it is to have your screening colonoscopies. It is a safe test to come in for. A colonoscopy uses a long, flexible tube with a tiny camera and a light source at its tip to examine your colon while you're sedated. It does require a bowel preparation to clean out the colon so we can see the colon as best as possible. Bowel prep is a medicine you'll drink to clean out your entire colon. It is prescribed by your gastroenterologist. A colonoscopy is the best test to detect polyps, and it's the only test we use to remove polyps and evaluate them for cancer. It is so important that you take the entire prep medication that your doctor prescribes. While it may seem tiring and time-consuming, it is the most important part of the colonoscopy. You need to have a good quality prep. This leads to a more successful procedure that decreases the time that the colonoscopy takes, and it does increase polyp detection and removal of polyps. If you do come in and your prep is incomplete, it may lead to missing polyps and cancer, and you likely will need to repeat the exam sooner. My suggestion is, when you receive your instructions on your bowel prep from your gastroenterologist, read those instructions. Read them right away. Read them a couple times through. If you have any questions, please call your gastroenterologist's office. Please don't wait till the day before you come in for your colonoscopy. Polyps are removed during a colonoscopy with a small tool that is passed through the tube or the scope. This prevents cancer from growing into the colon. Once they are removed, they are sent to a lab to be examined and to determine if they are precancerous. A colonoscopy can also directly diagnose colon cancer even before it causes symptoms. If colorectal cancer is detected, we work as a team to provide you with the most comprehensive and integrated care possible. We work together to develop a personalized treatment for each of our patients. Colorectal cancer treatment depends on the size and the location of the tumors and if the cancer has spread. Primary treatment options include surgery, chemotherapy, and radiation therapy. We offer advanced treatment options for colorectal cancer, including precision medicine, robotic surgery, surgery to remove the cancerous portion of the colon or the rectum, chemotherapy, targeted drug therapy, immunotherapy, halcyon radiation therapy, and other forms of radiation therapy. So, I've heard a lot of excuses in more than 20 years that I've worked in our GI center, and I am a big advocate to have colon cancer screenings because we care. We do care about you, and we want you to get preventative care you need. So ask yourself, what are your barriers? Are you afraid of the findings? You can't afford the preventative wellness care. I need to take time off of work. Are you afraid to be put to sleep? You don't want an IV because you're afraid of IVs and needles. You're just too busy to have this done. You don't want anyone to see your body. These are some of the reasons I've heard about why people won't come for their colonoscopy. But please, if you're not going to do this for yourself, do it for others. Do it for your family and your friends. This is an incredibly important screening that can prevent colon cancer. Please remember this too. Any screening test is better than not getting screened at all. You need to have an evaluation with a colonoscopy, and a colonoscopy is the only screening test that can treat and remove precancerous growths before they lead to cancer. I encourage you, if you have any questions at all, I have listed my phone number here. I am here for you. Thank you. Thank you for listening.